Emerging evidence shows that Black, Asian, and minority ethnic communities are disproportionately affected by COVID-19. The reasons are not yet fully understood, but health inequalities among this group have long been recognized. On the General Pharmaceutical Council register, there are nearly 30,000 pharmacists and pharmacy technicians from these communities. Our panel will be exploring how best BAME pharmacists and their teams can be protected during a pandemic and what lessons can be learned from the COVID-19 experience.
I don't think the guidance was necessarily clear enough that we had to do this kind of risk assessment. I mean, we got the templates from PSNC, for example, and we risk assessed the premises and staff in general. I mean, from a personal point of view, I would like to say that, you know, I kind of treated my pharmacy in more of a blanket way of, you know, however, whatever background you're from, whatever risks you may face, I don't want any of my staff to catch COVID. So actually my risk assessment was based on, you know, how do I protect all my staff to the maximum, short of them not coming to work altogether. And I think when I, you know, so yeah, the guidance wasn't clear enough to say, do a BAME risk assessment, I think. And on top of that, even to this date, there are very few templates that are available to us to actually use to carry out these risk assessments. It's been very difficult. I have now found one more recently. But again, you know, trying to develop your own on top of COVID when all this is going on, it's been a very difficult time. So yeah, it wasn't clear. Things are moving in the right direction, I would like to say. Hopefully more templates will come out for pharmacy to use, but hopefully also so everyone did use some kind of common sense approach that we must protect all our staff blanketly for to not catch COVID.
I think it's really important that we do have risk assessments done, but I also think it's important that the risk assessments that we use are reasonable. And I have seen one, which was sort of a BAME and general health individual risk factor assessment tool. And I think you practically had to be Black, over 55, with 2 or 3 health conditions and possibly pregnant as well before you counted as high risk. And then you start to think, well, is there a purpose to that risk assessment? If nobody is going to have an increased risk, why do it? And I think there could have been more guidance from the centre around those things. You know, well, how do you measure risks? How cumulative are they? You know, at what point is it, no, really, what are we going to do? I don't know that that guidance has been available.
We conducted a survey together with the Royal Pharmaceutical Society. We ran that for 10 days from the 12th to the 22nd of June. And we had a quite good response. We had 388 responses. And of those 236 were from the Black and Asian minority ethnic group. And what we found out was that around 166 BME have not been approached at all by the employers to do the risk assessment. And remember, this risk assessment was recommended 2 months ago at the end of April, and we had this shocking response. We also found out that 78% of those BME, they said in the survey that they felt at risk, and they felt that they needed to move away from the areas where they were working. In other words, they were telling us that they felt that they needed redeployment. So this survey just gave us a view of that the recommendations that were based on, you know, proper evidence that the BME community has been more negatively affected by the virus were not taken seriously at all.
There isn't a right method, but it's making sure that the message we give out and the risk assessment is tailored to the needs of the different people within the workforce. And I have to come back on this BAME, and I've just had a meeting with the NIHR now as well, one of the colleagues there. We grouping people into one particular group, it is so heterogeneous, and we need to be careful how we go about that. That's the first thing. Because the different groups and the groups within the different groups, in terms of their beliefs, attitudes, behaviors, can be very different. So I think that's one thing. The other thing, I may be digressing, but the other thing is the data collection is important in terms of the ethnicity of these people. Why hasn't this been done for a long, long time? I've been shouting that data collection, ethnicity on death is not recorded. And that would have given us a lot of insight as to where we are now, even with the COVID pandemic.
The really important thing, which I don't think has necessarily come through from the guidance that I've seen, is about what you do after you've got the risk assessment and when you've got the information. So risk assessment is a process that you go through and you engage with everybody to get really valuable information, because you want to know what risks are being faced. We've actually got a bit in our risk assessment to pick up on how people are also feeling. So it's an opportunity for them to also share anything else that might be pertinent, because this is an unknown kind of scenario for us all. And then the key thing will be, as the information comes back in, then we can actually start to work through that with positive actions based actually on the level of risk. But it's also not a one-off activity. People's circumstances will change. So the intention is that this becomes a living actual document. We have to encourage our colleagues to take some personal responsibility, because only they will know if their circumstances have changed. I believe it'll become a regular activity anyway, but there'll be an opportunity, because it'll be a live document that you can actually go into our tool and actually update it at any point.
My thoughts are that it's all well to say that we didn't have the information or we didn't know how to do it. I want to remind everyone that we are talking about risk assessment that potentially could save life. And I am hearing, I've got my members, they contact me on a daily basis, and they are telling me we are approaching our employers. And the response so far for many of them have been go to human resources and do the risk assessment. You know, this is not the time to justify what we have done, and it's not the time to, the truth is that many of the employees have been left out and have been left down by the employers. Many of them are going to work and they are working with lots of anxiety. Many tell me that the employers have got the capacity and have got the resources to redeploy me. They have got the capacity and the resources to perhaps rotate me and not having me all the time facing the public, and they are not doing it. And Black pharmacists, the one thing that you need to be aware is that many of them are working on 0 hours contracts, some of them are locums, some of them don't feel secure and safe to go to the employers and talk to them and say, look, I have got children at home that need me. I am pregnant, and you are asking me to still face the public when you can actually let me work from somewhere else. So it's about to have a reality check and stop avoiding those conversations. You know, I do not believe that employers so far have been open about it and going to the employees and ask them, going forward and say, I need to do your risk assessment. Everyone is sitting back and waiting. So we now have given them the right tools to do it. And it's about also another thing that I want to mention is we need to include Black in the writing these assessments, because I have seen some of these risk assessments where they split all the different Asians and they lump together all Blacks. The evidence is out there. Some of them came out from a study from Oxford University where there are different types of Blacks and they have got different risks. So this is something that needs to be taken into consideration, because when we talk about BAME, we usually left Black out. We have approached to be community change, and we have asked them to include us in writing this risk assessment, because otherwise what is going to happen, risk assessments are going to be written where still Blacks are going to be put at disadvantage.
I'm very disappointed to hear from Elsie that so many people that have been in contact with her don't feel safe going to work. I mean, one of the first things when COVID hit, I mean, I just want to say one other thing. we've been given 4 weeks to carry out a risk assessment. And like Janice said, great, you can tick box a risk assessment, but what do you do with that information afterwards? And also coming back, sometimes you think we do all this paperwork, but sometimes, again, it comes back to common sense. You know, the first thing when COVID hit, I was holding weekly meetings with my staff. What do you need to feel comfortable? What more can I do to make you feel safe? You know, we've done masks, we've done the screens, we've put hand sanitizer. I've made sure you're washing your hands every half an hour. Only one person to pick up the phone, restricting people that come into the pharmacy, posters up to limit the people, you know, barriers, etc., etc. None of that required paperwork. It required common sense and something to get on with it. And you know, weekly meetings with my staff to say, do you feel comfortable? They are the priority. So it's really disappointing to hear that there's so many people out there, employees, that don't feel safe going to work, and that employers aren't taking on that responsibility. So yes, usually I'm against sort of paperwork for the sake of a tick box. But you know, I also appreciate that it's there for our own evidence to say that we've done things. But hopefully, yeah, that you know now the 4-week deadline and so on will actually make some of these changes, and will actually make people feel safer going to work after as a result of it. Because like I said, doing the tick box is one thing, it's implementing the changes and your learnings from it. That's the bigger thing at the end of the day. Your staff are the priority. Without the staff, you don't have a business. So regardless, there's no money at the end of the day if you don't have your team. So I don't think it's an excuse, and there's nothing which has been said which isn't implementable, other than, like I said, there are the few where you say, unfortunately, we do have a high BAME prevalence in pharmacy in general. And there's only, after the measures that we've put in place, of the things I've just given examples of, short of that, especially for an independent, the last thing I have as an option is, well, I have to let you stay at home. You know, you've got a visor, you've got a mask, you've got gloves, you're washing hands every half an hour. You've stopped people from coming into the pharmacy, you've got the posters up. I don't have a central fulfillment center that you can go to. You know, you are the only pharmacist, therefore potentially you are always going to be on the front line talking to customers whenever someone needs the pharmacist's advice. Yeah. There's no hiding away from that. And if you're still feeling unsafe, you know, we have to work within our means. And it also, I think, you know, employees need to then stand up for themselves equally and say, I'm not coming to work. And hopefully then a few more employers might wake up.
Certainly in the risk assessment itself, we've said that, I suppose we've been a bit pushy, we expect employers to do it. If we find out that they aren't, and we do surveys on a regular basis, so if we find that a lot of our members come back to us and say, no, I've not had one, or that they've had other issues, we have a survey going out very soon, and it's saying, like, you know, not just within community pharmacy, but across the board for pharmacists, have you been asked to do activities that are high risk without PPE that you would feel would protect you? Questions like that. We will be doing those surveys. We will make those things public. We will also lobby, and that we have links into NHS England, etc., and GPHC. And if we have issues, we will say something. One of the things we did feel was that if we find that we're getting a lot of feedback from members and elsewhere that pharmacy owners are not actually doing these assessments, then we'd quite like to ask or talk to our colleagues in GPHC and say, what do you feel as a regulator about this? Is there anything that you can do as superintendents, etc., to address this? And obviously there are requirements under RIDOR and Health and Safety Executive. If an employer is aware that an employee of theirs has contracted COVID and is ill, or worst case scenario has died, and it can reasonably be surmised, or it's likely that they got that infection at work, you must report those to the Health and Safety Executive. So that's another thing that we would expect from employers. And you're quite right, if we felt that a risk assessment had been done, action was not taken, and that a member of ours suffered as a result of that, then yes, we would support them in pursuing, or their family in pursuing the employer for not having fulfilled their legal obligations. First, one of the key obligations of an employer is to ensure that your workplace is safe for your employees.
When you reflect on it, it is concerning. You know, at first, no PPE to be worn unless someone comes in suspected of COVID, and only then it's for cleaning, to where we are today, where essentially in pharmacy, community pharmacy, we're all wearing PPE, at least, you know. So as much as there's been responsibility to employers, yeah, you have to acknowledge that there's potentially been negligence by government on not providing us with the accurate information that we've needed. But again, I come back to, in my pharmacy, I implemented a simple rule. What makes my pharmacy team feel safe? I was having those conversations with them. And if they wanted masks, I got them masks, if that's what they felt was going to make them feel safe coming to work and so on. Again, and nothing was unreasonable, I don't think, in their request, and it ends up being that it was completely accurate.
Recently, we have actually gone out and said that the wearing of PPE is mandatory. That brings its own challenges, because there's, you know, issues that arise with the wearing of PPE, but we owe that to all our colleagues to be absolutely very firm in what we need to do. We've had to come up with some creative solutions, and some of that will feed through back into the risk assessment, where we'll be able to find out, and we've actually specifically asked for our colleagues to tell us any issues that they have in terms of what might come out of wearing PPE, because there's other challenges with that. There are no easy answers to the challenges that we've all had to face over the last few months. Everybody's working their way through them, making difficult decisions with the best information they have at the time, and you have to go and revisit that then when more information comes through and update it. So that what I challenge myself with saying, with the knowledge that I have and the information available at the point in time, am I making the best decision that I believe I can make with what's available to me to make that decision at that point? And we've had to go back on some things and say, last week we told you this, and this week we need to tell you that, because more information's coming through. I've actually dedicated somebody in my team to entirely spend their whole time on COVID and supporting the business as a COVID lead. That's actually somebody who is from a BAME background, Ifty. Some of you might know him in my team, and his whole time from February onwards has been about making sure we gather information, that we follow up, that we're getting all these things, and he's been supporting me and the business in that. And we genuinely want to do the best we can. Clearly, we're already looking and saying, what have we learnt? What can we do to prepare for a second wave? What did we get right? What could we do differently? Because clearly there are things that can be learnt and done differently. I don't think anybody's done anything deliberately, not as well as it could be, but we're all learning, and nobody's done it before. So, you know, everybody is trying to do their best. And I said at the start, we're all in this together, and we are all in this together, and we need to listen and act and work collectively to move the profession on.
I think one of the key parts here is that it's the ability to be able to let our staff be appropriately empowered so that they can share information. And there's lots of studies, but I know, I can't remember the study now, but the people from the Black minority ethnic group, self-reporting becomes less so, because they're worried. Employers need to understand that, and they need to make that atmosphere and the environment such that they may have issues in terms of the health, but make it such that they come out freely and as much as they can. So I think the empowerment side of it, I also think this is a great opportunity. We've started this, let's do it properly, because this is here to stay, not just COVID, but we could build on it from a health inequalities perspective, longer term, and how we can manage. And we can use community pharmacy to become a clear vehicle in reaching out to the communities out there, in engaging, because part of the NHS long-term plan. And this is one way of reducing the health inequalities where we've never been able to manage it successfully. Mobilise the 43% of the pharmacists in the inner city areas from a BAME origin, use their skills and expertise in areas where we need to.
As you say, there's been a catalogue of errors, but in dealing with COVID, I think community pharmacy in particular has really shone and shown new ways of working and shown how to be adaptable. I think what we need to take forward from this is, obviously at the moment, get your risk assessments done, look after and look after your employees the way that Amish has said, make them feel safe. But look at what we've done and look at preserving what might be good new ways of working, and potentially look at different ways that we can do things.
I think if you're not doing it already, start working and talking to your teams. You've got to work together on this. Equally, I'd say to both employers and employees, as sort of Janice alluded to, it's not a blame culture. It's not trying to find faults with what each of us has done. Need to move forward, need to just protect each other. And like you said, everyone said, we're learning day by day with this pandemic, and we're using the information that we have. And as long as the information that we're getting, I like to believe, is truthful and with the best of knowledge, then, you know, that's what we're acting on at the end of the day. So let's take this day by day as we already are, and let's continue sharing learnings. I think one of the best things that's come out of this is the sort of sector sharing learnings with each other. You know, bigger companies maybe implemented PPE quicker than some of the independents may have done, for example, and what kind of PPE and so on. And like I said, one person to answer the phone rather than anyone answering the phone. Just really little things of learning to all the way of virtual consultations. Let's just carry on sharing our learnings with each other to become a better sector.